My name is Fatima Bignell. I'm an educational psychologist. The role of an educational psychologist is varied and very diverse. Some educational psychologists work privately. More educational psychologists work within a local authority. We are involved in working with children and young people from the ages of birth to 25. We work with schools in mainstream settings, specialist settings, and it's a variation of many activities that we do, including consultations, assessments, training, identifying areas of need and how we are going to be supporting those, and also on occasion doing some research. Within an educational setting, the pathway that usually tends to happen is the parent raises concerns around their child's development. It's something that school also picks up, and they will have meetings in school with the special educational needs coordinator, with the SENCO, raising their concerns and how they are manifesting themselves and the impact that it's having within the child's education in school. Sometimes the school contacts the educational psychologist for further support, to problem solve around different interventions, different strategies, and there is that plan, do and review process that the educational psychologist would become involved with. Education and healthcare plans, or what used to be known as statements of special educational needs, often plays quite a significant part in supporting children and young people with autism or with ADHD. The formal diagnosis itself means that parents and settings have got more access to different services, but the education and healthcare plan is that document, that legal document that identifies the areas of need, also the areas of strength, but the areas that the child or young person needs to be supported in, and how that support needs to be put into place, whether it's through involvement of support services like specialist teachers of autism or autism outreach, whether it's through services like support or involvement, not necessarily direct, by occupational therapists in supporting children's sensory needs, or speech and language therapists. But it's a much more legal, contained piece of paper, really, that travels with the child, with the young person, as they grow older, as their needs change and as they develop. And it's something that is quite concrete in identifying the child's needs and how they can be met. I think the key tip or the key advice for parents who suspect that their child may have autism spectrum disorder is around having an open discussion with school, with their educational setting, to share their concerns, to be open about it, to ask questions and to have that open dialogue, really, with the school SENCO, with their child's class teacher, and to keep on going at it in terms of what their concerns are and what needs they think their child has.